Hello and welcome back to another episode of the Chiropractic Student Podcast. Today we are joined by Dr. Dan Brown. He's up in Chiro-life in Perth. I've wanted to get him on the show for a while. He also helps with chiropractic jobs online. He's going to tell us all of his juicy resources and advice and tips for everyone out there today. Thank you so much, Dan, for coming on the show.
Hey, no worries, and thank you so much for inviting me on the show.
Not a problem. I keep hearing your name kick about, and I just said it in the pre-show. Your name is known, I think, in the chiropractic profession, and so naturally, I was like, I want to know more about you, get you on the show, and give you a bit, like the listeners, a little bit more information about you. So, really simply put, could you just start off with kind of your background in chiropractic, what got you interested in it in the first place, and then your journey almost through, like, where did you study and then to where you are now?
Yeah, sure. So, I've been a chiropractor for almost 14 years now. I got into chiropractic when I was 15 years old, and I met a chiropractor called Dr. Graham White at a career convention at my school. And in actual fact, the only reason I stopped by is because he had these pretty funky pens with, they were like spine-shaped pens. So I stopped by to pick up one of those, and he then asked, "Do I want to find out more?" And I thought, well, I better not be rude, so I'll listen. Anyway, everything he kind of said just really resonated with me, and it was kind of the fact that you could help people just with your bare hands. There was the inherent healing power from the body, and just that sort of ideology that there was more to the body than the sum of all of its parts, and that you didn't always just need drugs and surgery. And the whole thing just resonated. And I think the other thing that really resonated with me was the fact that I could run my own business, and it probably appealed to my entrepreneurial side. So, at that point, I said, well, can I come and observe and see what it's like? So I did that, and just at that point, I decided this is for me. So I signed up to AACC, and I went there when I was just turned 18.
And you're from Scotland?
Yeah, I'm from Scotland, yeah.
Literally the opposite end.
It was literally the opposite end. But I do know a lot of people who've traveled a lot further to study chiropractic. So I suppose it wasn't too bad from that aspect. But it was great, I went to the ACC. It was 5 years for me, and then I sort of graduated when I was 23. And then from there, it's, I think, when I graduated, that was really when you start learning about chiropractic. That's when my learning really started anyway.
And where did you start off thinking that you were going to go down the route of in practice? Like, did you come out of uni and be like, I'm going to start my own practice straight away, or did you associate? Or what was your journey after that?
Well, when I graduated, I went traveling around South America and Central America for 4 months or so. Just took a wee break, and then went back to Scotland, and I actually got a job with Dr. White. So I was working in the Edinburgh practice, and one of the chiropractors had left the Perth practice, and unfortunately solicited the patients and taken them with him, which, it's, an unfortunate thing you hear quite often within the chiropractic profession. But I went up just to cover the remaining patients that were there. And then within a short period of time, the business obviously wasn't doing very well. So Dr. White decided to close it down. So I just presumed that I was going to move back to Edinburgh. And unfortunately, that wasn't the case. So I was kind of out of a job. So I thought, well, how about I take on the Perth practice? So Dr. Graham White and I negotiated a small price for the practice, and I took it on from there. I always had intentions of owning my own business. It was just so happened that was the opportunity that came up. So I took it on and built up the practice. And then within a year, I bought the commercial property. We then did a big refurb and totally refurbished the whole practice. We moved into another place for, I think, 6 months while we were doing that. And then just built it from there. Took on a couple of associates, took on a massage therapist, and then built the practice from there. And then, a few years later, I think we kind of hit a point where we'd kind of maxed out that space. And I was kind of getting a bit frustrated in myself, like we couldn't grow the practice any more than what we were. I think because of the size of the space, but also the other thing I was getting frustrated about was, chiropractic's amazing and you can get amazing results and really change people's lives. But if people are not taking responsibility for their lifestyle, how they eat, how they think, and how they move, there's a limitation to how well and how healthy they can actually get. So I really wanted to create a wellness center. And that was where, we were going to help them with their nutrition, with their exercise, with stress management, massage, chiropractic, and bring it all together. And I actually went to a seminar called 8 Weeks to Wellness, which was run by Dane Donahue and Joe Tilley. Yeah. And I was just going there just to get some ideas. And it was just, amazing. Everything that they did, the whole setup, the process, the testimonials, it kind of just blew my mind. And I decided then, right, I need to make an 8 Weeks to Wellness Center. So that's kind of what we did. A month later, I bought a 5,000 square foot office. We then did a huge refurb on that, and then kitted it out exactly the way we wanted it, and then went to set up this new style of practice. And I can say, the results that you get when people do 8 Weeks to Wellness is utterly amazing. It's for those of you who don't know what 8 Weeks to Wellness is, it's an 8-week program which includes chiropractic care, personal training, nutrition, supplementation. There's some meal replacement shakes, there's massage therapy, there's stress management, and then accountability right the way through. And at the start of the program, we do something called a wellness score, which is a complete functional health assessment, where we then measure all these different biomarkers and give them a health score. And then at the end, we do that exact same thing. And when you can see the objective changes that you're getting in people's lives, types of things like reversing type 2 diabetes, normalizing blood pressure, normalizing cholesterol, changing blood workup, obviously people losing body fat, improving core strength, flexibility, mobility, and a whole host of other symptoms kind of disappeared. And it's just probably one of the most rewarding things to do.
Wow. So in a few years' time, you're going full Gonstead and there's going to be an airport outside of Cairo.
Something like that, yeah.
Jeez, man. So the progression's happened quite... I know you've been in practice for like 13, 14 years, but that seems like you've progressed quite a lot in a fairly short period of time. And the 8 Weeks to Wellness stuff, like, I love the sound of that. That's so cool. And I think that's going to speak a lot to the younger generation as well. Like, I know there's old school chiropractic that's just a chiropractic adjustment is all you need, remove the subluxation and you're fine. But it's like the 3 T's, isn't it, that cause the subluxation? It's not just trauma, it's thoughts and toxins. So yeah, if the cause of that subluxation, if you're subluxation based, if the cause of that subluxation is because of the other 2 aspects, you can smash away at these subluxations and tell them to move and do whatever. But if you're not giving them the right nutrition and mindset advice, then really they won't get much better. I like that idea. Yeah, it's really cool.
Yeah, that's exactly it. It's, the point is, you got to recognize that there is a limitation to matter, and obviously removing a subluxation allows the body to adapt to its environment as well as it can do, but there is still that limitation to matter. Now, if you can change that environment slightly so they're not hitting that limitation of matter all the time, they're going to achieve optimal physical, chemical, emotional well-being. And I think, that's what you see. If you have someone who smokes their whole life, just because they've been getting adjusted, yes, they may be able to adapt better than someone who's not, but that doesn't mean they're not going to get cancer. If you have someone who's eating an awful diet and never exercising, you can't adjust the fat off their waist. You can't stop them from having a heart attack or, these diseases, lifestyle related diseases that are the biggest killers in the UK and, well, North America and, probably any of the developed countries.
It's an interesting one as well. And so had you always been interested in that whole aspect, like the wellness kind of clinic, or was it literally until you'd heard about that seminar you mentioned, or conference you mentioned? Was it really up until then Like, was that the turning point for you, or was there always an interest?
No, there was always an interest. I think, if I go back to my goals when I graduated and stuff, I always wanted to have a multidisciplinary clinic, where we were, bringing in various different, modalities. So I think there was always an idea of that. And, within, my first clinic, I'd written nutrition manuals, I did a lot of chestnut stuff. So I talked about that with my clients all the time. We did kind of posture, booklets and handouts and emotional stress and, mindfulness booklets. So we were trying to support our clients with all of this kind of information. But the biggest thing that I always found with that is, you can give people information, but if they're not, fully, what's the word I'm looking for, but like fully engaged in it, they're not actually going to do it. And I did health talks every week. We talked about nutrition, all sorts. But if I actually looked at my patients, they weren't losing weight. The biggest difference I would say with this was, you get people and you go through this initial wellness score, which clearly shows them where they are. It shows them what their body fat percentage is, their visceral fat, their BMI, their resting heart rate, their blood pressure, blood workup, and as soon as they can see all these things in black and white, there's no hiding. And it's not my opinion of whether they're overweight or whether they're unhealthy. This is black and white, and we're comparing it against to where optimal health should be. And I think when people see that, that's a huge thing for them. They go, whoa, this isn't, just someone saying I should probably do something. This is black and white results. And then obviously when you go through it, one of the things we always try and do is dig into their why, how is their health impacting their life, and where would their health look like, or what would their health look like if we could improve it? And that can be quite an emotional question for a lot of people. And then once we find out what their health goals are, we can then put together a care plan that's going to get them those results. So, it's as soon as you do stuff like that, these are game changers to the way that you're managing your patients and getting the best results out of them.
So in terms of so if a listener is interested in this approach, apart from obviously looking into the 8 weeks to wellness style of things, what were some resources that you were reading or listening to or looking at that kind of got these juices flowing in the first place, even way back at university when you said you wanted a multidisciplinary clinic? What sort of things were you looking at?
Well, I think I was always interested in nutrition. So, exploring various different, nutritional kind of plans and what's healthy and, what you're trying to achieve. And, so I was always exploring that. For me, exercise was always something I was into, and I was always trying to, improve my physical health that way. And so then it was a case of, trying to work in, what kind of things are going to be naturally best for us. I think James Chestnut probably, his books really kind of got me onto the whole paleo style diets and the paleo kind of movement and stuff there. There's probably tons of different things I've been reading over the years, but I think the ones that stand out for me are probably James Chestnut stuff. And then obviously moving over to the 8 weeks to wellness, all the resources and the support with that is huge as well. But I think, what you've got to remember is, there's this lifestyle based stuff, and then there's also chiropractic. And I think you need to get proficient as a chiropractor first before you kind of move on to the other things, because you need to be able to be confident and certain with the chiropractic. Otherwise, I think that it can kind of get lost when there's all these other, modalities and therapies or whatever you want to call it. And I think that if you do really get proficient as a chiropractor and then you add on these other things, the chiropractic becomes the root. We are called chiropractic life because that is the glue that holds this all together. And we start with the adjustment, and then we have all the other things in and around that. And I think that that's one of the key things that we strive hard to do, is make sure, people don't forget about the chiropractic and the importance of that. And one of the other things that I think is good is, the fact that, our chiropractor, I practice Thompson technique. We host Thompson-Minardi, every year for his module series. And, we have, I don't know, 30, 40, 50 chiropractors come every year. Obviously not during COVID, but, once we can get that going again, I'm looking forward to having a heap of chiropractors in the clinic again. But so Thompson technique was really the protocol that I used, and that's what helped me get certainty in knowing where to adjust, but not just knowing where to adjust, but when to stop adjusting, which is another thing. And then once you've cleared out the spine, find it, fix it, leave it alone type thing. So yeah, kind of going off on a tangent there, but yeah. I think the key thing I'm trying to say is make sure you get proficient in the chiropractic, and then kind of look at these other things as well.
That's good. And like how you were following on your sentences is pretty much the next question I was going to ask. So it worked out quite well. You just took control there. And I like that. Obviously, it's chiropractic life, and chiropractic is the glue that holds it all together. That's what stuck out for me there as well. But when it's when someone comes to the 8 weeks of wellness, it's like a pyramid. Is chiropractic at the top, or are they all level?
Well, chiropractic would probably be at the top, or the foundation, however you want to look at it. And the reason for that is because the chiropractor is the one who's going to do the examination, who's going to recommend the care plan, and then from there, they will then, have built into their care plan all these other services. So the chiropractor is the main person who's managing through that with the support of the team. And it's really important that we have a really strong team and a team that work together. In some multidisciplinary practices, one of the things I see is you've got lots of different therapists, but they're all in it for themselves. So that they don't want to refer to someone because they think they're going to lose the patient, or one's better than the other, and there's this one-upmanship, and it's just really not teamwork. Whereas one of the key things that that we work hard to, especially with the core values, is making sure that we are kind of all equal in that sense, but the chiropractor will be the one sort of guiding them through that and managing them through the process. But as far as teamwork goes, no one's better than anyone else, and everyone's on the same page, and all there to get the best results for the client.
Yeah, it's putting the patient as number one, and you all just have the patient's interest. I can get on board with that. It's nice, and I completely agree. I've been to multidisciplinary clinics where there's a massage therapist at the clinic rather than the massage therapist is part of the clinic. There's a massage therapist who rents a room at the clinic, kind of thing. So I like the idea that it's all tied together in it, and it makes complete sense, and everyone brings something new to the table that the other one doesn't. Like me offering nutritional advice would just be pointless. So why do it? Not pointless, but I mean, get a nutritionist on board, or the same as a personal trainer. Like it makes sense.
Yeah, get the expert in that area to do that part. Instead of the chiropractor who does the adjustment, does a bit of soft tissue, a bit of dry needling, a bit of rehab exercises, and then some taping and all that. And I think that with that, you become like a jack of all trades, master of none. Whereas why don't you get the soft tissue therapist to do the soft tissue work? Why don't you get a personal trainer or a physio or someone to do the rehab or the exercise, the chiropractor to focus on the spine? So everyone is an expert in their area, and they bring, as you say, something to the table. And one of the things that we actually do in our practice, which is quite good, is every Monday we do a skill share. And when we say skill share, it doesn't necessarily have to be a skill, and it could be an interest, anything. And so one member of the team will prepare a 30-minute presentation. They might host a workshop. They might host a mastermind. They have free rein to do whatever they choose. It could be a topic that they're interested in. It might be business or investing, or it might be, today my practice manager spoke about EFT. Previously, my marketing manager, she went into core values and how to identify what your core values are and how you use them to assist you, but also recognize when they're holding you back. We the week before that, I did it, and I held a mastermind on basically, we've got a new membership program, so I wanted the team's input, what we thought the benefits, the weaknesses, basically did a SWOT analysis on that, and I used the team for that. So, every week we do this, and it's great because, it's amazing how much, each different member of the team has to offer, when you do it. So it's doing things like this that really make, it unique the way that we do it.
I mean, it sounds like really awesome, and I think it's, for me, it's like I'm just like, I want to give it a go. I want to do the 8 weeks of wellness to try it. Actually, it'd be really cool. Although I'd have to come and live in Scotland, or where I think Joe Tilley is like, is he near London? I don't know. I'm like,
yeah, he's in Epsom, or just outside Epsom. Yeah,
I'm smack bang in the middle, so I'd have to live somewhere for 2 months. But it sounds really cool. Changing the subject a little bit, in terms of aha moments for you, like when a light bulb goes off, maybe it was during university, maybe it was after university, or even before. Was there something that you heard, or obviously you've mentioned Dr. White that you saw before. Was there anything in particular that you heard or you saw that was like, oh my God, I get it. I understand chiropractic. This makes so much sense to me.
I can't think of any specific moment. I think you have mini aha moments all the time. I think one of the things that I found really valuable was communicating with patients, like, talking to them about health, talking to them about chiropractic. And, you're just talking and trying to explain it, and you come up with new analogies and stuff like that. And then you're like, oh, that's quite cool. Where did that come from?
Yeah.
And you're just in your flow chatting, and some of these things come out. And I think, the more that you're doing that, the better you become at explaining it, at discussing it, at understanding it. I think the better you are at being able to teach other people, the more you understand it yourself. And I always found that was, an extremely helpful way. Some patients will ask you questions in a certain way, and you're like, oh, right, how do I come at it from that angle? And then, you answer it, and I think you kind of shock yourself sometimes, and, pennies drop. And I think also reading some chiropractic philosophy has been, massively important in helping you understand exactly, what is chiropractic and what's not. And what's chiropractic and what's, lifestyle, because, for me, the key thing is going back to health. If you go to the definition of health, health is optimal physical, chemical, emotional well-being, and not merely the absence of disease or symptoms. So, trying to chase disease or symptoms is not healthcare. What you've actually got is you've got a healthcare model, which is achieving optimal physical, chemical, emotional well-being, and you have a sick care model, which is focused on removing disease and symptoms. And that's the first thing I always explain to people. Like, when you come here, you're in a healthcare clinic, not a sick care clinic. So we don't like to talk about diseases and symptoms so much. Ultimately, if someone does have symptoms, we're not going to ignore them. You have to, meet them where they're at and understand and empathize with them. Otherwise, they're not going to come back. But equally, you then need to lead them, in the health direction, and that's in the promotion of things that are going to promote physical, chemical, and emotional well-being. And those things are your kind of lifestyle. And then chiropractic is something slightly different, because it's more about, innate intelligence and how that, expresses itself within the body and how your body adapts to its environment. And it's when you're trying to explain all of this to patients and lead them down that I think there's so many aha moments to be found.
It's true. And I've literally only been out for like 3 or 4 months, and I have it now where a patient will ask me something in an obscure way, and I'll just off the cuff just answer it straight away, and I'll be like, oh, and I'll just be like, oh yeah, it is that. Like, it's really as simple as that. And it'll be like a sentence that I'll say that just makes complete sense about connection between the brain and the body, they'll say, oh, so if there's a movement here or whatever, and I'll just be like, well, yeah, obviously if it does this, then it disconnects, blah, blah, blah. And they'll just be like, yeah, it just makes sense. And then I'll be like, oh yeah, like even in that moment, just understanding that, recognizing that aha moment. I love
exactly.
it.
And it's just finding different ways to, using metaphors or analogies or anything to articulate what you're trying to mean, or using things that they already know. It's kind of like, if a patient says, oh, so how long do I have to continue doing this? It's like, well, that's up to you how long you want to, but our recommendations is that you do. If you were to compare it to brushing your teeth, for example, when are you going to stop brushing your teeth? And then they go, oh, well, what do you mean? You're going to brush your teeth as long as you want to have clean teeth, and you want to get your spine checked and adjusted as long as you want to have a healthy spine and nervous system, and it's just using things that they already relate to. Like, no one would question when they could stop exercising. They understand that they need to exercise as long as they want to be fit. They need to have a shower as often as they want to be clean. They need to brush their teeth as long as they want to have good hygiene, or dental hygiene. They got to eat salads and healthy food as long as they want to be healthy, so it's then bringing it back into that health paradigm and taking it out of the sick care paradigm, which is very much, once the pain's gone, there's no reason to continue treatment, and it's that education and using different ways to explain that.
It's so true. And you obviously have so much experience, and the way you just explained it, I've not heard it explained like that before. And it just, again, for me, I've just had an aha moment, like that just clicked. That just makes complete sense. And I'm going to use that this week in my report of findings and initial consultations. Like, when are you gonna stop brushing your teeth? Like, how long do you think this is gonna take? Like, that's so true. Switching subject a little bit, you mentioned at the start, and your chiropractic jobs online. Where did that come from? What's your involvement? Could you tell us a little bit more about that, please?
Yeah, so I'm the founder of Chiropractic Jobs Online and the CEO. I set up Chiropractic Jobs Online maybe about 6 years ago now. And really the key thing that got me to do it was I was struggling to find associates for my own practice. And I'd advertised on association websites. I get advertised in the UCA, the SCA, the BCA. And, I had very little, applicants from it. And I just thought there must be something. There must be one universal place where chiropractors can go. And I reflected back to when I was a student, and I was like, well, where do I find the jobs? And, I remember there was some jobs on the notice boards in the uni, but they got snapped up, or if the university lecturers didn't like the jobs, they would just take them off the board. And then, you would go on to the UCA, the SCA, and the BCA. And I think when I graduated, it was also quite difficult because unless you were a member, you couldn't always get access to some of the stuff. Yeah. And it was just, really difficult. And I was actually helping a friend at a Gonstead seminar, actually. And I remember speaking to students there, and they were like, where do you go to find jobs? And I was like, right, this is definitely a problem, because I'm struggling to find students, or new grads or associates. They're struggling to find it. So I said, I just need to set up something, a platform where all chiropractors worldwide can go and post jobs, and all chiropractors worldwide can go and find jobs. And the key thing about it for me is also it's about connecting like-minded chiropractors, because I genuinely believe that we can strengthen the profession if we get more of the like-minded people into the right clinics. Like you're working with Tom, and provided you guys share great core value or the same core values and you're working along together, that clinic is going to do far better with the two of you working in the same direction than two associates or two chiropractors who have completely opposing views, core values, and everything. And, the other thing that I saw as well was a lot of new grads would go out, they'd choose a job based on the fact that they wanted to be in the central London, or they, or it was, 50%, wages, or it was, it was monetary, or some of these things which I don't think are always the most important thing to be looking for as a new grad. And within 6 months to a year, they were disillusioned about the profession, they were unhappy, and they just really weren't liking it and questioning whether they wanted to be a chiropractor. And, it took, a few years, it probably knocked their confidence as well. And it took time for them to actually find the right job and then start loving the profession again. So for me, it was really, a multiple, thing of creating a platform that would make it easy for people to find jobs and people to post jobs. It was about connecting like-minded chiropractors and really understanding core values. And we really try and get people, when they're writing their adverts, to really get across the personality of the clinic and the values of the clinic, so they're attracting the right kind of people. And as a result, for me, that was a way to help strengthen the profession.
It's so good. And like you say, like, I know so many students who struggle to find jobs, and I know 90% of clinics out there and chiropractic centers are looking for associates, especially like recent grads, because you can almost mold them to what you want them to be, or if they like what you're selling, then you can create a mini me in almost, like, without being rude, but you can like really help them on their journey if they want to follow your path. And it's insane because so many people I know who finished uni didn't have a job lined up, and I know loads of people who are looking for jobs, who are looking for associates. And you look, like you said, you mentioned the UCA pages and stuff, but I looked at chiropractic jobs online. My friends at uni were ambassadors, and they were like, oh, have a look on here. And I think that's where I found my job, on chiropractic jobs online.
Yeah, I love to hear that. It's great.
I'm pretty sure that's where I found it, because I saw it come up on a website, and it must have been that. It was a while ago now. It's probably like a year ago when I found it. But that's mad. It's insane how it all comes around. And I'm not going to lie to you, I had no idea you were the founder of it before I asked you coming on to the show. I just knew your name because it kept coming up. I just never knew you were the founder of it, which is poor journalism.
We've got a really good team there, and they run the whole day-to-day stuff. So most of the time, if you're speaking to either Bianca or Cassie or Josh or anything, you'll be speaking to them than opposed to myself. And they're awesome. So if anyone does need any help, whether they're looking to find a job, by all means get in touch with us. Myself, get in touch with Bianca or Cassie. And also, if you're looking to find an associate, again, get in touch. The company's growing, a lot over the last few years. We're getting bigger and bigger, and, having, a larger database of chiropractors, a larger database of employers, of jobs. We do recruitment now. I wrote a book, 7 Steps to Hire Your Dream Associate, which is available on Amazon. So again, as an employer, if you're looking to get information on how to go through that, it's all there. And it's really all, the essence of it all is about understanding your core values.
And like I mentioned as well, like, there's likely, if you're a student listening to this, you're going to have an ambassador at your school, and they'll be posting on Instagram, because I know my ambassadors from my uni always post that they're the ambassador for chiropractic jobs online all the time. So just get in contact with them, and they'll send you in the right direction as well.
Definitely. I don't think we've got an ambassador for every university worldwide yet, but we're getting there. So if anyone is interested in finding out a bit more about the ambassador program, again, get in touch with us at Chiropractic Jobs Online. Just either send them a Facebook message or on Instagram, or the email's hello@chiropracticjobsonline.com.
Amazing. I think that's like a nice way to finish off the podcast. Like, you've given us so much information. I've written like a whole page of stuff to put in the show notes. So that's really cool. If people want to get in touch, find out more about you, about what you do, how can they do so? What's the best way?
And either just get in touch with me on Facebook or Instagram. I probably use Facebook a little bit more than Instagram. Not quite that hip on Instagram yet, but either or, get in touch with there. Or my email is Dr. Brown, drbrown @chiro-life.co.uk.
Amazing.
I'd be more than happy to help in any way I can.
Perfect. I'll put all that information in the show notes. But it's nice and easy to find online. Amazing. Well, thank you so much for coming on the show and sharing all of your knowledge. It's been a real pleasure talking to you. So I really appreciate you giving your time up for myself and everyone else who listens.
Yeah, no, Lewis, it was my pleasure. Thank you so much for having me on the show.
Thank you. We'll see you all next time.